Recording in progress.
Hi, Dr. He, are you ready? I'm gonna have Donna comes up and then we'll start, okay?
Yes, no problem. I'm ready.
Okay, good morning, everyone, and thank you for joining us for today's webinar with eLotus, your leading provider for continuing education for acupuncturists. My name is Donna Chow, and I'm your host and your moderator for today's class. Today's webinar is TCM Neurology with focus on senior degenerative diseases, Part 1, presented by Dr. Chong He. Before we begin, let's go over a few things. Today's webinar will run from 9 a.m. to 6 p.m. Pacific time with 4 breaks. Lunch is 1 to 2 p.m. Lecture notes can be downloaded from today's course access page. And if you want to join the chat, please set your chat preference right now to everyone so we can all see your response. For questions for our speaker, please type them into the question box in your Zoom control panel. He will answer the questions as time allows. And finally, the quiz and video replay will both be available tomorrow, and you will receive an email notification when they are ready. Let's begin by welcoming Dr. Chong He. He has over 35 years of clinical experience as an acupuncturist. He specializes in acupuncture and Chinese medicine for neuropsychiatric and ophthalmic diseases, clinical research. He is the CEO of Oriental Asclepius, as well as Vice President of the American National Association of Chinese Medicine. Dr. He previously taught a weekend ophthalmology course with us, which is now available for purchase as a distant learning CEU video. He is one of the few TCM specialists in the treatment of eye diseases. So if you want to learn more about eye diseases, he is the person to learn from. When I return to my computer, I'll post the video link for you. All right, so let's get started with today's class and welcome Dr. Chong He. Dr. He, please go ahead and take over the class now. Would you share your PowerPoint, please?
Okay. Okay. It's time for the class now, right?
Yeah, go ahead, Dr. He.
Okay.
We see you loud and clear, and we see your PowerPoint, so we are ready to go.
Okay, very good.
Thank you.
Hello, everybody. Good morning. Welcome you guys come to this class to enjoy our class. Before this class, let me introduce myself. I'm an acupuncturist in Florida. So far, I run the office Oriental Asclepius, just like Donna said. And I practice acupuncture for many years. Especially I'm interested about the neurological disease. Actually, I started working in the neurological hospital in 1993. At that time, something made me so interesting. That's why I started to pay more attention on neurological disease. At the time when I work in a hospital, I see a patient. I didn't realize he's my hometown. Some friend daughter, he suffers from MS. Her condition is very, very tight and stiff in the hypochondriac area. Every time when she comes, doctor will just give her some steroid medicine, and then she get relief. Over the time, she just gets so tired about to use this steroid medicine. She want to looking for something else. She's still young. She's just about the 20s. I happened meet her and said, okay, let's try some acupuncture. The first attempt is very successful. After needle around the GIG points, her tightness around the hypochondriac area, the flank area, much improved. That's not only surprised me, but also my mentors. At the time, I'm an intern and doctor in that hospital, and they all interested about this. Actually, they, thinking acupuncture maybe could be a very good idea for neurological disease treatment. Okay. A couple of years later, when I come back to my hospital, I work as a director for the ward inpatient department for acupuncture, and one of my friends, her mom was diagnosed as Parkinson disease, and all the neurologists told her this is very pessimistic because there's no future. The disease was gonna develop anyway. We just try to use dopamine. Danny, try to release your symptoms. Try to make your symptoms relieve, nothing else. It's not a really rich family. And so because his son is a student of Chinese medicine college, she tried to use some Chinese medicine. I remember first attempt we used is 学辅助语文, 学辅助语文. This is very popular formula. I guess most of our participate will know that formula very well. That is one. This is the formula for the blood stasis in the chest. Miracle happens. After use that, her symptoms get much improved. Her body looks like be tight all the time, from top of the spine all the way to the sacrum. Her neck always tight, have to lift her shoulder all the time. But after that, the condition get better. That story makes me think neurological disease, especially neurodegenerative disease, maybe it's not like pessimistic. Maybe we could open a way to help our patient to take over this kind of condition. Because of this, we try to apply the grant from the Chinese government and for Parkinson's disease treating by acupuncture in 1995. This program lasts for about 3 or 5 years. Okay, so because a lot of things going on with the clinical work and the lab work, something else. And things impressed me is this Parkinson's disease, we improved several patients dramatically, and some patients even don't need the medication. We have to say this is a little bit different. In China, we are MD. We could prescribe the Western medicine tablet. Also, we could decide to stop it right away. But here in American, we are only acupuncture license. We cannot give patient any suggestion like this. By law, we cannot do that. This is why every time when patient gets treatment and really need to reduce the medicine, we have to recommend him contact a neurologist. Let them know you are in treatment of acupuncture and your condition get improved. You need to reduce your medicine. And that's what we should do now here. All right. So all this story just to make at least make myself so interested about the neurological disease. Even today, I'm still very, very interested about this. And I try so many cases, and some patients really encourage me, make me feel, okay, we cannot just let this knowledge just keeping quiet. We have to share with somebody else, all these acupuncturists around the United States. So this is why I try to have this class, but fortunately, Notice College accept this class. So I'm so happy about this. Okay, so today's class is dealing with neurodegenerative disease in traditional Chinese medicine. Okay. Now let's start this medicine seriously. In this class, we're gonna try to introduce at least 4 points, okay, just like slideshows. The first topic we have to discuss is about what is the neurodegenerative disease. We could omit it as NDG. The second thing is what are the problems in dealing with NDG? And then we could just roughly look over what kind of NDG in clinic so far. And of course, in the last, we will introduce a little bit more detail about how we deal with this kind of disease with Chinese medicine. So this is what we are, general, content we're gonna discuss in this class. So this class we are broken as 2 parts, today and tomorrow, generally in about 8 hours. So I hope our information could really give you something or make you feel, oh, that makes sense, let's try. Okay, that should be fantastic. I cannot say I'm the expert. I cannot even say, I'm very good in this. I only say I'm really interested about this. I still think there's a lot of room to improve in our treatment. So we need more and more people knowing all this opportunity. Maybe it could bring a patient a new hope. Maybe in your clinic, you could use this knowledge, or from this idea, give you some clue, you develop your own treatment method and make you have a new idea, bring the benefit to your clients. That should be fantastic. All right, so what is a neurologic disease, a neurodegenerative disease? Look at the picture underneath A, B, C, D. The first one we consider maybe it's a little bit normal, but you see number B, you see a lot of cortex area in the brain is atrophied. And here is atrophy. And the brain cortex lost, make a big space in cranial cavity. What's going on? Where this brain tissues going to? Mostly by common sense, 50 years ago or even 60 years ago, our tissue dead, mostly supposed to be necrosis. The necrosis always, we could find the discharge or the neuron body in the infected area. But this degenerative disease, not. They don't have anything left. They just gone. Looks like this neuron never exists. It's not true. This neuron used to be there. Now, just gone. Without any knowing reason. Just looks like reached some age. What is God's for the God? What is, Caesar's for Caesar? It's gone. Only left this a big cavity in the cranial cavity. That is the first impression of neuron degenerative disease. So now let's go into the first part. What is a neurodegenerative disease? The neurodegenerative disease is not a new topic, but for some people, still new. Okay, in the neuroscience, there's a lot of research on, right? So far, the latest news, latest research results report we could see to define neurodegenerative disease from a pathogenic view, we could at least see misfolded structure, protein inside the neuron. Everybody knows that our protein has a tertiary structure, but in the degenerative disease, this protein lost this tertiary structure, lost it. They become very strange structure. So we call this a misfolded structure. We found that inside the neuron, So this is the first. So pathogenically, as long as we see that misfolded structure protein in the neuron, we could think about, neurodegenerative disease. The second, some people don't agree, some people gradually, according to clinical manifestation, people start to knowing that neuron inflammation always comes with neurodegenerative disease. The third thing is signal transferring inside the neuron or between the neuron or inside the brain, hemisphere or cortex or spinal cord may be blocked, either prosynaptic or intracellular. So this kind of a blockage is exactly the reason to cause the various disease symptoms in neurodegenerative disease. And the fourth signs for the pathogenic view is apoptosis. Okay, apoptosis. And also, we also could see necrotic apoptosis. And in some tissue, we could see autophagy. So this is the fourth. And the fifth one is inhibited cellular movement. Yeah, cellular movement. So cellular movement, especially signal running, is limited. Okay, and it's not on the cells' bodies destruction only. If we looking down into the neuron's gene, we could see, methylated and misdecorated DNA, in the neuron. Okay, so if some people ask, how do you know these people has a neurodegenerative disease? Logically, we have to tell people, the stronger evidence is a pathogenic view of pathogenic views. There's 6 pathogenic views supporting stronger evidence. Okay, stronger evidence. So we just explain this through this slides. Let's just take a look. What the general image should be. That could be a little bit easier, for us to understand what that means. All right. So if neuron is okay, it's normal. It's always like this, But as long as the DNA get damaged because of stress, it's not mental stress only, all different kind of stress, finally cause DNA damage. And this damaged DNA will will cause the cellular problem, cause cellular problem. And this cellular problem actually something like mitophagy, a lot of dysfunction happened in the mitochondrial, dysfunctioning. All right, so that is what directly cause this problem. And if mitochondrial dysfunction start, this neuron lost looks like electrical power, lost energy, cannot survive like this anymore, right? Actually, when neuron face to this damage, our neuron is not just simply get injury. They also generated NAD, and certain this kind of protein and peptide try to repair it. So recently, NAD plus and certain become a product try to use in clinic for all this degenerative disease. And if this, this protecting, line successful, your neuron, okay. If the neuron damage goes through this NAD plus or sirtuins, and the condition decline, getting worse. And then what we could see is neuron, senescence, or kind of apoptic, inflammation will start. Okay, so in this process we could see, okay, the neuron damage, we're gonna gradually appeared from microscope views. Okay, so what exactly we could see under the microscope? So this is a normal neuron. We see that is very nice. Okay, just like standard image could show us. But if people has neuron degenerative disease, we could see something a little bit different. What's different is they are. The first we will see is we call the neuron fibrillary tangles. Neuron fibrillary tangles. This picture here is very nice. Could shows the fiber, tangling inside. Actually, this fiber maybe come from this kind of what we call the microtubules. Okay, so this kind of stuff seems deformed. And if we magnify this image even more, we will see on this microtubules, there's a lot of protein we call a tau protein. They supposed to be like a glue, stick all this structure and keep this structure very stable. But this protein is broken, deformed, and doesn't work to prevent the general structure of the microtube. And that's what directly causes this kind of abuse. All right. And another things we could see is amyloid plaques like this, could see around the neurons. That this is another things. And this protein actually is kind of what we call the alpha, synuclein follicles. It's kind of protein, This associated with synapse contactions, they deformed. So that caused the problem. All right. And inside the neuron, we could see this red, pink stuff, like a red stuff like this. Okay, so we have a name of it called the Lewis body. Lewis body. Okay, this Lewis body is very typical. Used to be, very typical to mention as these people has neuron degenerative disease. Okay, so and also we could see the follicle, around here, around, you see, all this kind of stuff, okay, around the neuron. It's all come from a alpha-synuclein follicle. If we see this follicle in the substantia nigra, in Parkinson's disease, they even think this is a label from morphological science, okay, in Parkinson's disease, So this is the general view, okay, this is general view. So if one day you have a patient come to you, give you all this doctor's report, okay, by this general introduction, I hope you could understand what this report exactly means. Okay, that means you could understand this kind of degenerative disease more detail. All right. So what I want to say is in general, I only say in general, it's not everyone. Okay, in general, these kind of degenerative development, the changes mostly only happen on the neuron. For the glial around, around the neuron, mostly is pretty normal. Okay, so now they affect these glial so much. All right, so actually, to be more exact, neuron degenerative disease mostly is neuron damage. Okay, so we spend a little time to introduce about this neuron degenerative disease. Okay, hopefully, this just for warming up. Okay, at least now we understand what it is, right? All right. So what's neuron degenerative disease, does in clinic? What's happened if people has neurodegenerative disease? What kind of manifestation should be? I have to say, neurodegenerative disease is not one disease, it's a group of disease. But no matter what disease, they all have these 4 characteristics. All right. So the first one is this disease, okay, always have neurodegeneration, and degeneration start and get injury, finally get apoptosis, gradually in death. Every people just like this. I used to have a patient, he's about 42 years old. He was diagnosed as ALS. Very nice man, very tall, very handsome. Okay, and he come to our hospital. Actually, he walked in with a little bit limping, and we see during the time he stayed in the hospital, a little bit different. In China, people could stay in hospital much longer than in US. But we could see his leg getting weaker and weaker, gradually develop more symptoms. Finally, he died in the hospital about respiratory failure. All right, so the disease from a neurodegeneration, get a central nervous system injury, and then neuron apoptosis, like atrophy disappeared, just like the first picture we showed, and then death. This process almost for every people. It's not like every people just like this. Need a bit longer, some people need a bit shorter, it's all different according to people constitution. And another things for all this neurodegenerative disease is no matter who you are, okay, every people have a progressive advancing. So no exception. Everybody does. Okay, everybody does. So far, is there any medicine could stop this advancing? My answer is no. We don't have it. And we have an ALS patient here in Florida. He has he looking for all kind of treatment, but finally seems like not getting any better. All right, so I see his condition from walking and gradually muscle atrophy and gradually muscle stiffness and gradually become freezing diaphragm. People cannot breathe, have to stay with the breathing machine and then dead. All the process progressing. Do we want to stop it? Yes. But can we? No. Does a neurological hospital could stop this advancing? No solution yet. So progressing, constantly advancing. No way to stop it. So this is the second thing. The third thing is all this neurodegenerative disease is not only stay in one area. They could be multiple systems involved. Okay, it could involve to the central nervous system or peripheral nerve. All right, it could be in the hemisphere, could be in the middle brain, could be in the palm, could be in the spinal cord, could be everywhere. So that makes people difficult to define what kind of condition these people should be. Is there any typical marked symptoms we could tell for this kind of disease? No, don't do that, because it's no labeled disease. Okay, labeled symptoms, no. Okay, because most of disease is multiple system involving. Okay, and we see in the last is most people dead, not always much before the neuron dysfunctioning or neuron death, much more before than that, because even when the neuron dysfunctioning happen, they cannot support or innovate the muscle or even smooth muscle well, and then cause a lot of pathogenic conditions, and the patient may die much earlier than that. But in the end, all these kind of patients, the neuron, the fate, the end should be neuron dysfunction and death, for sure. Okay, it seems like so scary, but the situation is more scary because according to the statistics, today we have more than 50 million people struggling and suffering with this neurodegenerative disease over the world. And some people even think, we even don't know why this disease so far started getting bigger population in around the world. And seems like incident is keep increasing over the year. Some people even believe that in 2050, this kind of disease may reach to 110 million people. That is catastrophic. That's catastrophic. Okay, so today our medical system spends so much time try to control this kind of disease, but it seems like very stubborn. It's very, very stubborn. Not so many solutions we could make to control this disease. I have a picture here. I just want to explain. I just add today just by, I just do it, occasionally because I want to explain a little bit about how dopaminergic neuron, distributed in the brain, and when patient has a dopaminergic neuron injury, this dopaminergic pathway damage, what kind of symptoms should be? All right, so generally in my brain, this is almost like a 5 branch. The first branch is a olfactory nerve. They are dopaminergic, neuron, and then they have a branch to the frontal cortex, and also they have a branch to the striatum, and also they have a branch to the substantia nigra. And I know this area in the middle brain, substantia nigra, finally cause Parkinson's disease, right? That is what we all could see. And also, this branch could go into the hippocampus, and cause a lot of mental conditions. All right, so I just want to explain. This picture shows us when neurodegenerative disease happen, they always could affect multiple area, cause multiple systemic involving. That is what I want to say. All right, so now let's go into the next. Since this disease is so annoying and become a very, very huge threat for our human health, especially for the senior citizen, we always are curious about what caused it. So according to all these publications, papers, researches, what we could see, just like this. Okay, first, we divide all these causes as a 2 parts. First, we put 3 of them as a primary reason. And then we put another 6 reason we call the other reason, secondary reason. Primary reason said it could be associated with genetics. And a lot of people try to confirm in the lab and say some genes may associate with several diseases, like Alzheimer disease, associated with genes, and ALS associated with genes, Parkinson disease, they all. But this kind of gene-related condition never more than 20%. Never more than 20%. So this is very, very hard to tell. Very hard to tell. So we only could say we cannot ruling out this kind of a reason, but we cannot say gene is a direct reason. This is so significant Because a lot of patients come to us, they will say, oh, doctor, I have totally no hope because this is genetic. Okay, my family have this. We know there's no cure and we're gonna die. Patients feel mentally so pessimistic and totally lost hope. If you lost hope, the treatment really get involved, get affected. So this is why we always tell people, I cannot say no, but I cannot tell you are the one, maybe genetics, because only 20%, right? Only 20%. Another thing is associated with the environment. So the problem are caused by something, environment problem, weather, and some, water quality, or maybe people, cannot get use of the season change. By the way, I have to say, most of the neurodegenerative disease, the season change always catastrophic for them, because when I was running a Parkinson disease clinic, we noticed that every time season change, around the 15 days, and most people condition get worse. So we could guarantee environment definitely will cause the symptoms worse. Clinically, if we see people symptoms get changed, can we could we could even speculate these probably a reason. So that's why we put the environment as a reason. The third one is aging. Just like most people want to say, neurodegenerative disease is it's kind of aging problem. Most people get this problem when he's more than 50 years old. It's not true. Just like I said, the one girl I met in a neurological hospital, she got MS in 20s. And another patient had ALS. He has a condition in his 42. So not all of them like this. But if we look at the clinic, more than 70% of patients is senior. So this is, we cannot ignore aging could be the reason. But why? Don't know. All right. So after we discussed about the primary reason, let's go to the next one, the second reason. These other reasons could associate with alcohol. A lot of people drink too much alcohol, start getting shaking hand. People could get trauma. So clinically, we could see, when I do Parkinson's disease research, we used to do the Parkinson's disease model, animal model. I used the rats. I selectively, ruin the substantia nigra in the rats, according to the guidance of the machine. We will definitely induce the, Parkinson's symptoms, right? It's not a typical like Parkinson's disease because the rat has the different, manifestations. But let's see, clinically, if people get trauma in the war, in the accident, especially car accident, or some, injury, if this injury really, ruin the substantia nigra in the midbrain, the Parkinson symptoms going to come up. That's for sure. All right. And also what we could see, the trauma occupation. So sometimes this is what we already see in the clinic. A lot of people start get Parkinson's disease. They start to use dopamine, everything, for a while. Finally notice, oh God, it's not, a typical primary, Parkinson's disease. It's come from a tumor occupation in the midbrain. Okay, so this is what for this kind of patient, CAT scan. I personally, I don't like CAT scan that much because the resolution is not good. MRI may be more useful for this kind of, we could say diagnosis. Okay, diagnosis. And some people after surgery, we remove that tumor and release the operation, and the symptoms are gone. Symptoms just gone. So that is very good. That is very good. So this is a third reason, and the toxin is another reason. Today we have, very how to say, we have a tendency to, medical abusing. So a lot of people use so much medicines. My patient in our clinic, sometimes when he come to my office first time, I always have a medical record, the first visit medical record. And in the record, we have a question, what the medicine you are using now every day. The patient said, hey, doctor, I cannot remember. I give you a list, okay? After that, I give you a list. You see, he have so much medicine used as a routine, okay? This kind of a chemical. And, I'm not saying the medical itself, sometimes even the carrier of the medical probably is not compatible to your body and cause a toxic reaction in your body. So medical abusing definitely is a very important reason for this kind of disease. All right. And of course, the virus, okay. So the virus is another problem. And people get a Parkinson condition, get MS, it's very common, get MS because of a flu, after flu, because of virus infection may affect your central nervous system. The stroke and ischemia in the central nervous system, especially in the brain, but we cannot say especially in the brain, almost everywhere in the central in the nervous system could be the reason. But I have to say, all these other reasons is not a direct reason. It's not a direct reason. Mostly they will cause the disease we call the. Let's take example. If they cause the totally same symptoms like a Parkinson disease, I prefer to call them Parkinson syndrome, or we call them Parkinson-like syndrome. That is more accurate. And all this kind of reason could be inducing reason, really triggered the real degenerative process happen. Since then, the condition start and gradually developing and advancing, and make a very, very bad consequence. So we discussed so much. Finally, we want to say, in general, neurodegenerative disease, what's the reason of it? Not clear. We totally don't understand what's exactly happened. We totally don't understand what's happened. So far, we have no any idea about the cause. We only have, some, research facts in peace is far way to make a final conclusion, leading us to get a clear conclusion to say what is the cause of neurodegenerative disease. Unclear. Okay, so now we switch to the next slides. If a patient comes to you, they will tell you, hey, doctor, I use this medicine, I use that medicine, I use this medicine. You may get a little bit confused. So I just introduced a little bit about today, what kind of treatment we do for this kind of disease, And most important disease we use today, because we don't know what the reason, we always use a neuron protective agent. Seems like there's a tree in your backyard. This tree seems like doesn't grow very well. Instead, they start getting smaller and smaller. What are you gonna do? Maybe you're gonna go to, the store to buy the shelf for him, try to prevent him from wind, from sunlight. This is a protection. But that is not it's not a real treatment, because it's not exactly, it doesn't really get the point. We don't know what this causes. So every treatment seems like doesn't really catch the point. So according to research, people notice that some calcium and antagonists, probably good, like nimodipine, nicardipine, something like that. Something like glutamate, at the agonist, antagonist could be good. All right. So this is the medicine we list here, right? Okay. And glutamate releasing inhibitors. Yeah, the medicine name like this. Frankly, I have to tell, we are acupuncturists. We have no right to prescribe this medicine at all. No. We introduce this not for you, suggest you use it. No. Just want you to know that. So maybe your patient right now just use this medicine. You know that. And you know what this patient received. Okay. And just make your brain a little bit clear. Okay, a little bit clear. All right, so we are not specialized on this, so we just try to go a little bit fast. Let's go to the other treatment. Other treatment, recently, most interesting treatment, very attractive to patient, is a stem cells transplant. Stem cells transplant is very fascinating. It's definitely new technique. Is that good or not? I cannot make a comment. At least a couple of my patients use that. They have a different comment. Someone said, oh God, after this stem cells transplant, it's so successful, I feel much, much better. That's good news. And some of patients after this transplant, things getting worse. Much, much worse than before, even death than after. So, good or not, hard to tell. I'm gonna tell you guys what's my opinion about this. All right. So it's a really kind of a Western medicine thinking style. Okay, Chinese medicine may be thinking different way. Okay, so another one, they try to use the new functional cells, implant. Let's say if a patient has Parkinson disease, they could transplant some stuff. They could release dopamine. Okay, we use that and transplant into the brain. Okay, and this does make some symptoms relief, but it's not permanent. So we have to say all this treatment is good, but not lasting. Doesn't lasting. Okay, so that is a pity. That's a pity. All right, and of course, the most common way to use is neurotransmitter replacement. So neurotransmitter replacement, typical idea is dopamine. Okay, dopamine. People use the carbidopa, Selimand, all this kind of medicine try to levodopa, try to replace the neurotransmitters. And actually, this treatment is the primary treatment for the patient today for Parkinson's disease. But the problem, this is double-blind. Somewhat, this is good. People start to even rely on it. But the second hand, another side, this medication cause a lot of side effects. For example, they will cause involuntary movement. That is really interesting. Not so many people familiar with what the Parkinson's disease is. I'm going to tell you guys in this class with very clear, definition. But a lot of time people get a trauma. They always think that the disease gets worse. So this patient with Parkinson disease come to me. She has a trauma like this. And then soon, just several months later, because the doctor changed medicine for him, his checking become this. Okay. If you see this clinical change, the checking like this, it's not like this anymore, right? What that means? That means your disease get worse, your Parkinson disease develop? No. It's because the new medicine causes involuntary movement, because this is not pattern of Parkinson's disease at all. Okay, so trauma has a different pattern, so we have to know that. Okay, so this medication, something good. Another thing, another side, they will create a lot of symptoms. Patients don't understand it. If you don't familiar with this disease, you may don't understand. You just feel, oh God, maybe our acupuncture is not as effective. No, it's not about you. It's about the medicine, because the side effect. Okay, so this kind of dopamine medication has so much side effect, called heart disease, called liver problem, called stomach problem, high blood pressures, something like that. So we have to know that. So if we know this, clinic we could figure out, what exactly problem is. All right. You even could ask your patient, go to a neurologist, give you some, medicine adjustment. Okay, and that is what we could do. And circulation improvement. Circulation improvement somewhat is ignored by most doctors. I remember when I was in China, okay, we work in the neurological hospital. we always recommend this kind of a chronic condition, go to the hyperbaric treatment. I'm not sure my pronunciation is clear enough to make you understand what I'm saying. So the people stay in the chamber, and in this chamber they put a high concentration of oxygen, and for about 1 hour, maybe a little longer, something like that. This kind of treatment seems like very, very useful for this patient. Something I definitely feel, after this kind of treatment, patient feel happier. Patient has a foggy mind. After use that, the brain is clear, and patient sometimes after treatment, his limbs become stronger, the muscular strength increased. So that is good. Actually, what makes it? Actually, what makes it is your neuron get a little more oxygen provider. That's going to be the reason, right? So circulation always recommended for this kind of disease. All right, and the last things clinically we're going to use is neuron nourishment. Neuron nourishment medicine is very, so much products. But for us, we are alternative medicine. Actually, there's a lot of things to do. Okay, so when I was in China, there's a product we call the first milk of the cow. Some manufacturer collect this, make a powder, to some patient with neurodegenerative disease. Actually, this make people feel so good. For long-term medicine, this kind of a neurodegenerative disease, because the condition keep advancing, people's constitution is weak, and also people have to overgoes the medication lifetime. So there's a lot of internal weakness. Actually, this really affects people's constitution. So this kind of a neuron nourishment treatment make people feel better. So what I could see is after use this, people's complexion looks nicer. Okay, looks nicer. Sometimes people get more energetic, and sometimes we could see people get a little bit more mentally optimistic. So that is very nice. So in general, all in all, so far, this is the most way the neurologist could do for our patient. All right, so this treatment always they try to protect the neuron. Actually, this is very blind. Okay, this is blind. They only doing this with a kind heart, mercy heart. How it works, who knows? Because we even don't know what's caused it. If you don't know the reason, how can you guarantee this is good? Very hard to say, right? Okay, but some treatment like a stem cells transplant, that is good. Okay, that's good. Definitely make a patient have a symptomatic improvement, but more or longer or shorter, they just cannot last. That is a shortage. That's a shortage. I used to have a patient. She did not stem cells. She did they call the nuclear, ruin therapy. Okay, so the doctor tried to ruin some the nucleus in the basal ganglion area. Okay, so after doing that, patient felt better, but unfortunately, this surgery actually damaged the patient's thalamus and induced the thalamus pain. Okay, that patient not really, they just want to come getting better, but finally, thalamus pain killed her because this pain is totally intolerable. So surgery is a good idea, but it's not every people, could be that lucky. All right. So this is why, so today there's a lot of people choose surgeries, but even after that, people still could come back looking for the alternative maintenance because they see alternative maintenance have something, good points. Okay, some beneficial. All right, so this is the general method the Western medicine will do for neurodegenerative disease. So neurodegenerative disease seems like not so friendly for us. And for all these neurologists, they lost encouragement for treat this disease. I have to frankly say, this neurologist, even the neuron scientists, they do a lot of research. For these several decades, neuron science developed so much. The achievement is so, remarkable. But for the detailed neurodegenerative disease, they still make them nausea. Because the treatment is so, cannot be pried on it. Cannot be pried on. So first, the reason the treatment for this disease is not successful, I think the biggest reason is that we don't know the reason. We don't know the cause. We have no target. So if you go to the forest and looking for the hunting animal, you cannot find an animal. How you could do? That is a big problem. All right. Is that a real no target? No. We already told you. In the brain, in the nucleus, we see, so much pathogenic changes. And this is confirmed. We don't know the cause, but doesn't mean we don't know the target. The target is there. Target is right on the middle brain. Target is right on the hemisphere. Target is right on the cortex and the spine, the pons, medullas, all this area. But we see that target. We just like the person stand on the riverside. Just let this water go all the way to the east. We can do nothing. We cannot change the water directions, current directions. Everything seems like uncontrollable. So we have no specific solution for that. So the second thing is because we have no method for that. And there are no any solution to stop the advancing of this disease. So a lot of people today getting so timid when he has short memory loss. I went to the senior hospice. The manager talked to me. So many people now get so scared because he noticed the short memory loss. Short memory loss is so popular for all these people get aged. But why they get so scared? They scared. They didn't scared. They don't scared by the memory. They scared about the neurodegenerative disease. They really scared about to be a senior dementia. You see, because they all know if this disease happen, no solution, no treatment at all. Okay, so the last one. So far, no any method even can stop degenerative actions. So this is what happened. I have a MS patient recently. This patient come and he cannot walk stably. I did some assessment. I check her MRI. I check his lab test, everything, and the report already done by the neurologist. I check everything. Finally, I give her, herbs and doing acupuncture for her. The condition seems improving over time. Looks nice. All of a sudden, one day, she come and cried to me and said, "Horrible. I hardly come and walking. I almost cannot come here today." I said, "What's going on?" She said, "I don't know. Just happened." This is very common for the MS patient because the patient constantly recurrent, because this kind of a new attack constantly happen. Sometimes could be severe, sometimes could just very mild, So is there anything could improve that? Some people could prevent it. That is what we want to do. That's what we want to do because Western medicine has totally no solution on it. So when the patient comes to me, I try to check her rhombus size is negative. That's good. That means it's not a deep sensory impairment. And then I ask her to do the nose pointing test. That is positive, especially on the right side. And then I ask her to do another test called the hair knee shin slither test. Hair knee shin slither test. This kind of test just check the cerebellar, functioning. The right side is still wrong, still positive. Okay, we're doing acupuncture specific on that. Just one treatment. Her balance come back. She laughing. She gets so happy. She said, "Oh God." She get more confidence on it. But I still tell her, have to be careful because just like the recurrent come constantly, So we try work on it, So this is for reason. Neurodegenerative disease today is very difficult to be controlled. So most neurologists already feel so frustrated, and then they only give people the routine medicine, and then no idea. So this is very pessimistic, but pessimistic somewhat is an opportunity for us. Okay, so this is what I try to introduce this in Chinese medicine. Okay, so we talked so much about neurodegenerative disease. Neurodegenerative disease, what kind of disease should be? There are so many. So here we give you a little bit, not all, just a little bit. Something like Alzheimer's disease, Parkinson's disease, Lewy body disease, the frontotemporal dementia, ALS, Huntington's disease. Okay, blah, blah, blah. So many. Okay. In this class, we will discuss 4 diseases. Okay, we cannot introduce everything. We're gonna discuss 4 diseases. Okay, first, we're gonna introduce Parkinson's disease, and then ALS, and then ALS, MS, and Alzheimer's disease. All right, so I think it's time to take a break. All right, so take a break. We will see you in 15 minutes later.
Recording stopped.